Are you struggling with fibroids? You're not alone. Did you know that at least 80% of women develop fibroids by age 50? Hi everyone, my name is Dr. Anthony, and today we're going to be talking about fibroids. So, what are fibroids? A fibroid is a non-cancerous growth that develops in the wall of the uterus, which is the womb. So, we have four types of fibroids, and they are number one, intramural fibroids. These types of fibroids are located within the muscular wall of the uterus. They can be located anteriorly, posteriorly, and in the upper parts, which is also known as the fundus of the uterus. Number two, subserosal fibroids. They are located on the surface of the uterus. They can also grow outward from that surface. Number three, submucosal fibroids. Now, these are the most common types of fibroids. They are located in the muscle beneath the endometrium. And also, by the way, the endometrium is the innermost lining of the uterus. Number four, pedunculated fibroids. Now, these kinds of fibroids are a variation of both subserosal and submucosal fibroids, and they are attached to the external part of the uterus via a stalk. Five reasons why submucosal fibroids are the most dangerous types of fibroids. A submucosal fibroid is a type of fibroid that grows underneath the lining of the uterus. When it comes to location, this type of fibroid is considered the most dangerous, and let me tell you why. Because number one, they can block the fallopian tubes, and once this happens, it can prevent sperm from reaching the egg and actually fertilizing it. The fallopian tubes are a pair of slender tubes located on each side of the uterus, and they connect the ovaries to the uterus. Number two, they can interfere with implantation. Implantation is the process by which the fertilized egg attaches to the lining of the uterus. Number three, they can cause the uterus to contract, and this can lead to a miscarriage or premature birth. They are also known to increase the risk of heavy bleeding before or during pregnancy. This kind of bleeding can lead to anemia and other health problems. Did you know that 35 to 50% of women who develop fibroids will never develop any symptoms? Fibroids are benign tumors that grow in the uterus. They can be small or large. They can cause different kinds of symptoms, and sometimes they can actually be asymptomatic, which means they don't produce any symptoms. Now, symptoms can vary based on different factors like the size of the fibroid, where it is located in the uterus, and what type of fibroid it is. Here are some of the most common symptoms. Number one, painful intercourse. You know how the fibroids protruding from your uterus continue to apply unnecessary pressure on your organs? This uncomfortable pain increases during intercourse, and it's even a lot worse if you're not lubricated. Number two, increased urination. You have to pee like all the time. And this is because the fibroids are applying pressure on your bladder, which in turn makes it seem like you can never hold your urine. Number three, lower back pain. Now, have you ever carried a backpack that felt like it was filled with bricks? Your enlarged uterus can crowd up your pelvic area, which now pushes against your lower back, leading to serious pain. Heavy menstrual bleeding. Fibroids can stimulate the growth of blood vessels within themselves. The formation of these blood vessels means that more blood supply to the fibroids, and unfortunately, these extra blood vessels can also contribute to heavier bleeding during menstruation. Number five, abdominal and pelvic pain. A general feeling of discomfort in your tummy and in the area below it. This is just like someone roughly massaging the inside of your stomach without any permission. Number six, irregular periods. Fibroids can cause bleeding in between periods, and it can also cause hormonal imbalance, which can also affect the regular flow of your periods. Number seven, bloating. As fibroids grow, they take up more space in your abdomen. This can apply unwanted pressure on your internal organs, including your intestines. This usually leads to a sensation of bloating and discomfort. Number eight, painful periods are associated with higher levels of prostaglandins. Now, prostaglandins are the hormones responsible for uterine contractions. Higher prostaglandins in your body means that you will have prolonged and intense cramping during your period. Number nine, anemia. The main culprit here is heavy menstrual bleeding. Fibroids can significantly increase menstrual flow bleeding due to several factors like increased width of your uterus, which is caused by the fibroids popping out of the uterus, creation of their own blood supply, and also irregular uterine contractions. Symptoms of anemia caused by fibroid can include fatigue and weakness, shortness of breath, dizziness, pale skin, rapid heartbeat, and headaches.